infectious diseases, research, medicine, health. Welcome to Outbreak News Interviews. And now, broadcasting from the Outbreak News Skylar Studios in beautiful West Central Florida, here is your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Well, hey everybody, this is Robert, and welcome to Outbreak News Interviews. Now, September is Sepsis Awareness Month, and according to the CDC, 1 in 3 people who die in a hospital have sepsis. In fact, 250,000 Americans die from sepsis each year. Now, joining me to talk about sepsis is Dr. Amy Sprague. Dr. Sprague is the Patient Safety Manager at the Roudebush VA Medical Center in Indiana. In addition, she serves on the Sepsis Alliance's newly created Sepsis Coordinator Network as an advisor. Dr. Sprague, welcome to the show, ma'am.
Well, thank you so much for having me. I appreciate it.
You bet. I appreciate it also. Let's go ahead and start out with some basics and a definition. Now, what is sepsis, and what are some of the risk factors?
Okay. Well, Surviving Sepsis campaign defines sepsis as a life-threatening organ dysfunction due to a dysregulated host response to infection. While that sounds overwhelming, let me simplify it. It just means that our body goes into somewhat of a hyperdrive to fight the infection. Once I've heard this called rapid friendly fire, and that just makes sense to me. The body tries so hard to fight the infection, it overproduces and becomes severely inflamed. Some of the risk factors for this are very young and the very old and immunocompromised.
Okay, so kind of piggybacking on that, who does sepsis affect?
Well, it's easy to say the very young and the very old and immunocompromised, but from where I've been sitting, sepsis affects all of us. It's an equal opportunity destroyer, if you will. The more I see sepsis, the more I'm convinced none of us are safe from developing it. There's a case you could look at by Rory Staunton. He's a 12-year-old boy from New York City who developed sepsis just after diving for a ball and getting a cut on his arm. That cut wasn't adequately washed and cleaned at the time, and he developed sepsis and later died. Or there's Erin Flatley. Her family developed Sepsis Alliance. She was just 23 years old and developed sepsis after a simple surgical procedure.
Now, the early detection of sepsis is critical. Can you talk about the diagnostics that are out there used for the early detection of sepsis?
Well, sure. One that I'm very familiar with is called procalcitonin, and it's a lab that can help in 2 different ways. One, it can be used to help detect sepsis early in a bacterial exposure. So if your procalcitonin is going up, more than likely you've been exposed to bacteria, and it's picking it up in your blood. Procalcitonin can also be used to help stop antibiotics early, and this is crucial to help us with antibiotic resistance.
Now, sepsis is considered a medical emergency, and the rapid treatment is critical. Can you talk about sepsis treatment?
The 3-hour bundle is what is the buzzword around sepsis, and the elements of the 3-hour bundle include a lactate, drawing a lactate, obtaining blood cultures, giving broad-spectrum antibiotics, and giving 30 cc's or milliliters per kilogram of fluid. That's quite a bit of fluid, and the early treatment has been shown to increase patients' chance of survival from sepsis. We know that for every hour we delay antibiotics, we increase a patient's chance of dying by 7.6%. Time is everything when you're dealing with sepsis. Early recognition must be our goal. We must be able to implement that 3-hour bundle early and timely. And sepsis care is as important as the care that we give to a stroke patient or to a heart attack patient.
Now, concerning the recovery of sepsis patients, everyone's a little bit different, right?
You're so right. It's very true. Sepsis Alliance estimates that 50% of us will develop a post-sepsis syndrome, and that's those of us that do come down with sepsis. In this syndrome, a survivor may be left with physical or psychological long-term effects, such as insomnia, and that could be difficulty getting to sleep or staying asleep. It could also be nightmares, vivid hallucinations, and panic attacks, disabling muscle and joint pains.
Now, what key areas can be focused on to prevent sepsis?
key areas for all of us include good hand washing. We should clean all wounds immediately with soap and water preferably, and this would even include minor cuts. Protecting yourself with a flu vaccine is very important. Talk to your doctor about other possible vaccines that may help you. The flu is deadly. Get the entire family vaccinated. Protect yourself while you're in the hospital by asking when lines can come out. Like if you're well enough and you can get up and go to the bathroom, get that Foley catheter out that collects the urine. Get that out as fast as you can. Get out any large IVs. Get those out as fast as you can. Ask your doctor, can these lines come out? And also ask visitors while you're in the hospital to wash their hands, and make sure you're washing your hands while you're in the hospital. You'll also take any step you can in day-to-day to avoid infections. If you're sick, stay at home and take care of yourself. Avoid spreading infections to other people.
Okay, some really great advice. And I want to thank you, Dr. Amy Sprague, for sharing your time and expertise on this very critical topic. Thank you, ma'am.
Thank you.